Welcome to the Health Daily Show, your go-to where leaders, founders, investors share insights on growth, innovation, business building. I'm Chitra Nabat. Joining us today is Micky Tripathi, National Coordinator, Health IT, U.S. Department of Health and Human Services. Micky, welcome. Thank you for joining us.
Really happy to be here, Chitra. Nice to see you.
You're part of a federal agency leadership role. The federal government can be a gray box for many of us. So let's share some context. What is the U.S. Department of Health and Human Services, and why should we care?
Yeah, it's saying it's a gray box is generous. It's a black box to a lot of people. So Department of Health and Human Services is the biggest federal agency. I mean, it's enormous. And so it covers healthcare, which is government insurance programs, healthcare delivery, like with federally qualified health centers, regulation of that, public health, regulation of food and drugs, and programs that people become familiar with on the human services side that they may not associate with Health and Human Services, like Head Start, which provides sort of a ramp up for kids who need sort of preschool and other kinds of things. One area that I'll just mention, just to give a sense of the span, the amazing span, is the whole unaccompanied children issue of children on the border coming over the border and being unaccompanied. That is a Department of Health and Human Services function. Our Office of Refugee Assistance manage the unaccompanied children who are coming over the border. So incredible span.
Where does your office come in? And give us a sense of the scope and impact of your office.
Sure, yeah. The department's broken up into operating divisions that people may be familiar with: FDA, CDC, NIH. Those are called operating divisions because they have a very mission focus and they work with the market, they work with industry. Where ONC is a staff division, so we work directly for the secretary and we support all of the operating divisions. And in our case, we support them with health information technology. So we align federal agency strategies on the use of health information technology, and we work with industry to get good public-private collaboration on the uses of health information technology.
And how do you impact different healthcare industry stakeholders, whether it's payers, providers, the patient, consumer, even the startups, many at this conference at Vive?
Yep, yeah. So what ONC does is we focus on what I think of as a supply side. So we focus on the technology, meaning that we certify electronic health records. It's probably our biggest authority out there and the biggest impact we have on the market. So for any provider organization that you have gone to, and anyone who's listening who has gone to, I can almost assure you that the electronic health record that you see sitting on that doctor's office is actually certified by my office. That provides a sort of a foundation across the country of basic capability across the industry in those electronic health records. And our certification covers things like data standards, interoperability standards, requirements to make patient access available for patients to be able to access their information, and increasingly things like decision support. How do expert systems work in those systems? How do algorithms work in those systems? And there are ways that we can sort of make sure that we've got appropriate guardrails in those technologies.
Given all of the continuous pain, life to date, around the health record, and some of the issues that you talked about around data standards, interoperability, many problems which startups at this conference and other around the country say that they're solving.
Yep.
What can we expect in terms of the areas of innovation, the areas of impact, addressing these issues? And how are you working with stakeholders to accomplish that?
Yep. So everything that we're doing and that I'm doing is about creating an open industry ecosystem so that innovators can actually innovate without technology and data silos getting in their way. Right? The idea is that we all ought to be able to share information. We all ought to have open industry architectures to be able to share information according to open industry standards, and let innovators then innovate on what they do with that data, and let them compete on what they do with that data. So things like requiring open APIs, open industry standard APIs to allow the availability of that information so that innovators can scale their products across vendors, across providers. So you don't have to worry that, oh, they're on Epic, they're on Cerner, they're on Athena, I need to build 3 different products or 3 different versions of my product. Now we have a standard FHIR API across all of those as of December 31st, 2022. You can build your product and your economics with an assumption of scaling across the entire industry. That's just one example of the kinds of things that we're pushing and pushing really hard to be able to create that kind of climate for innovation to happen.
And following on that, you're working on something which will help all patients, consumers have a portable health wallet. and share information and access between payers and providers, some of which you're talking about right now. Talk more about this and the trusted exchange framework and common agreement.
Sure. So first, just talking about patient access for a second. Our requirements are what require a provider organization and their electronic health record to make the information available. So if you've been on a patient portal, that's an ONC requirement, that there is an ability for a patient to electronically access their information. The data that you see in the patient portal is actually required by ONC to be made available to patients. They can add things on top, but that minimum data they're required to have there is regulated by ONC. As of December 31st, a FHIR API, so that you don't have to be locked into the portal. You can actually have an app of your choice that, as long as it connects with that open industry standard, you can get your information into that app of your choice. And now you're no longer locked into that particular portal product. And if you have multiple providers, you can get your information across those multiple providers. The CMS, our partner, Medicare and Medicaid, they are requiring that health plans make available a patient-facing API based on the same standard that ONC has established in regulation, so that you as a patient will in the future have the opportunity to say, here's my claims data from my payers, here's my clinical data from my various providers, and now I can make that available to apps and services of my choice to help me on my wellness, healthcare sort of journey across my entire lifespan.
This all sounds too good to be true, because I know the challenges I have when I go to my health system in New York and I see the PCP versus seeing the specialist, and information seems to get lost from one to the other within the same EMR, electronic medical record. Too good to be true. So what stage of implementation are we at, and when can we see it more at scale in the country?
Yeah, I totally understand why you say that. My mother broke her hip last August. They were literally, and we were moving her from one hospital to another, both of whom were on really good EHR systems that I know are connected on the back end. They are literally printing out the record, handing it to me and saying, bring it to the next place. They will scan it and upload it. And you're just like, what are you doing? So I totally appreciate that. But I think that what we're doing now is we are establishing that common approach to interoperability. And we're already seeing that has sort of an effect in the market. So the providers themselves now, with that single brand, TEFCA, Trusted Exchange Framework and Common Agreement, they know the federal government is standing behind a network of networks model for them to be able to connect up and not worry about what network is that other party connected up with. Imagine a world where cell phone networks weren't connected with each other. So AT&T and Verizon weren't connected. So if you were on Verizon, I was on AT&T, we couldn't connect. Of course, that isn't the experience we have. We have connection in the back end that allows us as a user to experience as a single network. That's what TEFCA does. It says, let's take all these small and big networks across the country, connect them all up so that you as a user, whether you're a patient or a provider, can connect once to a network and get access to all your information and not even worry about what network are they on.
What are the obstacles to the realization of this at scale, and how are you solving for it?
Yep. One of the big obstacles is just the fragmentation of the industry on the supply side and the demand side means it's really hard for the industry to come together on certain things. You've got the classic prisoner's dilemma, right? People sometimes want to do the thing that might benefit everyone, but they realize that if they do it themselves and their competitors don't, they're just unilaterally disarming, right? With data access and all of those things. What we're doing, and one of the challenges with TEFCA is that it's voluntary and we got no dollars from the Congress. So we were directed to do it. We got no authority to tell everyone to do it, and we have no dollars. What we're doing is we're saying, well, how about if we have our federal agency partners like CMS, like CDC, like others say, we're going to have public health agencies participate in that. CMS saying, we're going to have Medicare and Medicaid participate in that in meaningful ways. That makes an attractor and something that's valuable to innovators and others to implement TEFCA.
Mickey, in every industry, there's a race to unlock and capture value from using AI on data, whether it's to harness the data, work the data, to provide insights. What are some of the most advanced uses of AI at scale in your organization and the outcomes that you're driving?
Yeah, so we ourselves, don't use it as an organization, but we are spending a lot of time thinking about how provider organizations and others use it in EHR systems, for example, and in those organizations. And we're very early in our AI journey here. It's kind of amazing that ChatGPT was made public, just a month and a half ago? And already, right, the amount of conversation, I was talking to provider organizations last night who were talking about how they're implementing it in their environments. And that's both exciting and terrifying, I would argue, because healthcare is got a different dimension. It isn't just like, create a sonnet, Shakespearean language sonnet based on last year's Super Bowl, right? This is like, no, figure out whether this patient has cancer and what some appropriate, sort of clinical pathways might be for that. So we're working hard on thinking about what are the sort of the guardrails? How do we get transparency over how algorithms are created, where they are appropriately used, and where there be risks that an individual clinician, for example, should be aware of before they deploy AI in any particular context.
There are thousands of startups here at the Vive conference who would love to do business with you. What are the characteristics or criteria you're looking for partnerships with startups? And what bar do they have to pass in order to be able to get a contract with you?
Yeah, well, so getting a contract with us is a little harder because we don't really contract in that way, but we are happy to talk to and help and collaborate with any organization. So contact us. I have an innovation lead named Stefan Kanya. You can contact me, Micky Tripathi at HHS.gov. We always want to hear from innovators in particular because we're here to support the innovators. We're here to say, how do we create the climate, both business and technical, so that the innovators can do what they do best, which is innovate. And to the extent that there are barriers that perhaps we're not aware of, or barriers, God forbid, that we're creating, we want to know about it so that we can help, sort of mitigate that and unleash the power that we know exists out there.
Leadership. In career and business, there are rules, codes, norms to how things are done. Where have you been a code breaker, and how did you do it?
Yeah, I don't know. I guess being a code breaker, and to me, it's all about, sort of being the very forward-oriented partner with any organization. It's always about figuring about, putting yourself in their shoes, figuring out what is the problem you're trying to solve, and then what is that we can do to help solve your problem. We can always find areas of difference of opinion, but more often than not, I've found that on important things, we can find areas of overlap. And that's what we're doing with ONC, with all our federal agency partners. We approach them and we say, we're not here to tell you need to use these standards because you need to use these standards. We're here to tell you that we can help you better accomplish your mission through more effective use of health information technology. So, I think that's what my whole career has been about, finding those areas where you need collaboration and then identifying that and then, pushing forward with it.
Micky, thank you so much for joining us.
Thanks, Chitra. Really enjoyed it.